Now, today I'm joined by our CEO, Al Lewis, as well as our co-founder, Peter Prozel, who's also our Chief Technology Officer. So uh, we're going to start right away here because we have a lot to cover. So why don't we just start with our introduction here and welcome everyone. Now, just a little bit about Quizify, the kind of the uh, housekeeping matters. We've been in business for 10 years. It was founded in 2015 by our CEO, Quizmeister in Chief, Al Lewis. And Quizify serves groups from 50 to 500,000, including Fortune 100 companies, small and medium-sized businesses, state and local governments, and colleges. And Quizify is also validated by the Validation Institute for Savings Achieved. And you can go to our website and see reviews and testimonials. Now, a little bit more about us. Our CEO on the left there has written two books. One is specifically about, it's entitled Why Nobody Believes the Numbers, but it is specifically about wellness outcomes analysis. So Al has really studied wellness programs. The other book that Al wrote was with Tom Emmerich, who managed benefits at more than a decade at Walmart. And below that, uniquely, Quizify has a relationship with doctors at Harvard Medical School. So when it comes to medically oriented content, you'll see that seal right on the question. So some of this health literacy information is somewhat new, and it's more believable if you see that kind of credibility attached to it. Now, we've also been featured in some mainstream publications. The late Marshall Allen's book, Never Pay the First Bill, which is about hospital billing practices and how to negotiate bills, gives us a nice shout out. The New York Times talked about us. And then the book on the right, we're going to talk a little bit more about, but we get some nice praise from the incoming commissioner of the FDA, Dr. Marty Makary. So now, without further ado, here's Al Lewis to talk about what's going on in wellness right now.
Thanks very much, Mark. First of all, I assume everybody can hear me. We're going to briefly ask the question whether traditional wellness has in fact reached its sell-by date. And we will also ask whether Quizify is the future of wellness. For that second question at the end, you can vote and we will display the results if we have shown you that in fact Quizify is the future of wellness. Has wellness reached its sell-by date? Well, there are two things that we're going to explore on here. One is health risk assessments, and the other is the screening or the wellness visit. We're not going to talk about the hassle and the expense because you already know about that. Now, health risk assessments have two components. One is to give you insights into your population as a whole. And this is the classic HRA question about how much you drink. The red line is the US average, which has been calculated up, down, and sideways. And the top decile accounts for 70 ounces a week and about half of all the alcohol, more than half of all the alcohol consumed. However, if you look at the results of a health risk assessment, you will find, I don't even care what company we're talking about here, you will find that essentially nobody is in the top decile. Nobody has a drinking problem. The most people will admit to is about 20 ounces a week. So you're not going to learn anything. And if you don't learn anything, you're not going to do anything about it anyway. The other thing that the HRAs offer is advice. And this is about making healthier choices, which is one of the things they do. And I'll focus you on the lower right, where they say you should eat low-fat dairy, fat-free milk and cheese, low-fat and non-fat yogurt. That's wrong. That is wrong. Dairy fat has been rehabilitated. I've got some 5% yogurt right in the fridge. But more importantly, how do you think they make non-fat yogurt taste good? We're not even going to make that a polling question because everybody knows the answer. And then there are biometric screens. Now, these biometric screens are fortunately not as popular as they used to be, but they generally find a ton of things that don't exist. They test people for a whole bunch of things that essentially under the age of 25, nobody has. So if you get a test that's 90% accurate, okay, 90% accurate, and you test 1,000 people who happen to be under the age of 25, none of whom have whatever you're testing for, you will get 10% false positives. You will get 90% accurate means 10% inaccurate. So you're going to tell 100 people, you're going to tell 100 people that they have this that they have whatever this is, and you're going to throw them into a tizzy, and they're going to end up with extra medical care they don't need. And in fact, my very own sister-in-law is an example of that. She was told everybody in their organization had to go to the doctor every year, and they did a thyroid screen, and it was inconclusive. And she said she had been feeling tired and had a few vague symptoms. So they couldn't rule out thyroid cancer. So they did a biopsy and it came back inconclusive. So they couldn't rule out thyroid cancer. So she ended up getting her thyroid out. And guess what? No cancer. Now, instead of being really upset that she was forced to get all these tests, she was very grateful for the wonderful care she received in the hospital. And oh, by the way, she has to take at least one pill a day for the rest of her life. Now, this isn't just us saying it. If you look at the book that Mark referred to earlier, The Price We Pay by the incoming commissioner of the FDA, he has a whole chapter called Diagnosis Over Wellness, and talks about a lot of things we talk about, the invasive questions, the screening of healthy people for diseases that they don't have. Now, here's the problem that you're in. The medical guidelines stipulate that most screening tests should not be done until a certain age. That's what the clinical guidelines say very clearly. On the other hand, if you are a self-insured plan, an ERISA plan, if you offer some people screening, you have to offer everybody screening. So you end up going directly counter to medical guidelines in order to be an ERISA plan. We have a solution, which is if indeed you still want to do these things, have appropriate medical screening, appropriate checkups and wellness visits, you can give people a choice of the visits or the screenings or playing Quizify. This right-hand side of this is right off one of our workplace posters, and it tries to convince the 20% of people who really would benefit from a screening to get one. This way, the people, they look at it, they say, you know, would I do something about this? Yeah, probably. So you get the 20% you want. The other 80% learns a lot more about healthcare, as you will today. Because Quizify, we are hypothesizing, is the future of wellness. The shift that's going on from the present to the future is a change from fixing the employee to educating the employee. Now, many of you have already downplayed the screens or maybe gotten rid of them altogether, and instead you've created challenges. The thing about challenges is that the people who participate in them are not the ones who really need to participate in them. We are talking about changing everybody's behavior because no matter how much you know, you can learn in health literacy. And then you get this whole report saying what your outcomes were, which, by the way, they probably weren't, to see if they're validated by the Validation Institute. Or you can pay a little bit and get actual measurable progress that you will be able to see with your own eyes without a lot of actuarial mumbo jumbo. Now, typically, incentives have driven engagement. You would have to do something, give people something in order to get them to do whatever it is you want to do. You'll find that with Quizify, relevance drives engagement, and we'll prove that to you in a couple of minutes. It's also much easier to implement Quizify. It's rolling the rock downhill instead of uphill. So let's talk about how we educate the employee. We'll take an overview of our curriculum, and then you will become the employee for a few questions. First part of our curriculum, as you might imagine, covers chronic disease knowledge and prevention. We have all these categories, but the ones that hit me viscerally are back pain and common MSK issues and prevention. We have a saying, and I'll repeat it later in this presentation, that 80% of back pain goes away on its own, but 80% of people with back pain are convinced they are in the other 20%. So we try to unconvince them. Now, I personally had heartburn. I was taking those horrible heartburn pills. And if you don't think they're horrible, you got to play some of our quizzes every night. And I fixed it totally using what Quizify recommends, including, among other things, putting your bed on a 8-degree incline at night. Now, oral hygiene prevention may not be important to you, but you're not paying much for it. Typically, a dental max is often less than the deductible for a medical plan. But trust me when I tell you that for employees, it's a lot different. Many of them have issues with their teeth, then guess what? If they delay care because they don't have the money, they become medical issues. Oh, hang on. Oh, there we go. Speaking of medical issues, we have another section on using healthcare wisely. It explains to people why they do not want to demand antibiotics when antibiotics are not called for. Something like 40% of antibiotics provided by dentists, pediatricians, and telehealth are inappropriate. And even some of these many of these over-the-counter medications that are designed for temporary use, people tend to use them every night. We go through that and talk about the ones that should not be used regularly, and yet they are. We've got a ton of general health knowledge. Gut health is a very popular topic. We've recently did one on microplastics. Here's a news flash. I don't know who you are. You can see me. I can't see you. But you've got millions of nanoparticles of microplastics in your body, including your brain. We can't do anything about the ones that are already there, but this quiz will teach you how to have many fewer coming in. Supplements are basically unregulated, and most do no good for most people and can harm them. There are a few that are helpful for some people, and our quiz teaches which ones it is. And ticks. If you live in a tick-infested area, which is to say 2/3 of the United States, you'll love our tick quiz. Among other things, we actually found a live tick on a blade of grass, and I put my hand there to show people it was not a crisis actor, it was a real tick, to show people how easy it is for them to just attach to you. I'd like to say no animals were harmed in the production of that video, but we got rid of the tick soon afterwards. Now, lifestyle, our alcohol quiz, it's 5 o'clock somewhere, is trying to dial people back on their alcohol consumption. We're not trying to get to zero because number one, there's a lot of reasons that the zero number is overstated. And number two, if you set the goals too high, you're going to lose your audience. So we're just trying to dial people back. Reducing dementia risk is huge. That's a new one for us. We're going to show you some examples of hidden sugars, reading food labels. Related to that is ultra-processed foods in a minute. We have a whole curriculum on weight loss drugs, starting with what we call the Before Your Journey quiz, which dissuades is 70 to 80% of people from starting on these drugs. And newsflash, those 70 or 80% would be the ones who would drop out after spending 3 months to 10 months of your money on these drugs. We lay out all the things that they're not hearing about. But then if they do continue on the drugs, we've got a year's worth of curriculum to help them be successful. We call it dissuade. We dissuade the GLP curious and we educate the GLP serious. We can also customize anything you want to your benefits design. In particular, what seems to be popular these days is urgent care versus ER. And avoiding high ER bills, which is one of our specialties as well. We have financial literacy. We even have cybersecurity. After X number of months, here's what your users are going to know. Speaking of ER, there's an entire industry of freestanding emergency rooms that have basically been set up to look like urgent care and charge 10 times as much. We show people the difference, and literally, if your population is geographically concentrated, we will give examples from your area about where not to go. Granola bars or candy bars, I don't care how healthy they say that they are. They're all bragging about their health, but in fact, they're just basically processed sugar for the most part. Now, they also know what questions to ask. And one of the classic questions that we teach when doctors say something, want to do a test, is how could the results of this test change the treatment plan? We also teach people to watch out for the words just to be safe, because that generally means the test is unnecessary. We're not saying don't get it. We're just saying ask some questions about it. One of our go-to, most popular, most impactful, most implemented questions is about filling kids' cavities. It turns out that there is a solution available that treats cavities better than a filling does at a small fraction of the cost. And some of you, this is a benefits example. Some of you have a telehealth benefit, and oftentimes you can get a prescription through it without going to the doctor. Now, of course, we just said that we're teaching people not to ask for antibiotics they don't need. So we don't want to make it too easy for them to get antibiotics they don't need. But once you're pretty sure you need something, you have a benefit for it. Now, our teaching method is a Q&A. It's a very well-established pedagogy. You'll actually see this happen right in front of you. Note the Harvard Medical School seal. And this is one that's happening live about the average adult's risk for a first heart attack and what can you do to lower it. We have a ton of healthcare hacks, this being one of them. One of our favorites is, yes, Cologuard is the best way to screen average risk colons, meaning if you haven't had a family history or personal history, getting Cologuard every 3 years will prevent more significant cases of cancer than a screen every 10 years at a much lower price and much less inconvenience. And yet, 21 million colon screens were done in 2023. Why? Well, the GI profession does not make any money off Cologuard. They only make money off the screens. We mentioned the thing about the back pain. We come back to that in multiple ways that so people don't over medicate. And we talked about the OTC meds and the harms. For instance, those little ZZZ meds, the ones with the stars and the moons on them, if you take them every night, you're increasing your risk of eventual dementia. We have the Harvard Review. They put their name on everything that except for brand names, and they'll even put their name on a few brand names. These are very easy quiz type questions that you're going to see us, you're going to play in literally, I think about 60 seconds. You will change your thoughts, if not your behavior, after at least one of these questions. And as we mentioned, we can do the benefits as well. Now, it's not just us saying this. Let's go back to the FDA commissioner, and his bestseller says, this is a great way to teach people. I love what Quizify is doing to educate employees about this. Far be it from me to argue with that. And most importantly, he was there. He saw Quizify help people make everyday decisions from how to read a nutrition label to asking tough questions about common overused medical procedures. And we'll show examples of both of those under behavior change because this is what we do. We change behavior. A person will change their behavior if it's valuable, if it's easy to do, and they know how to do it. No willpower or coaching required. A typical behavior program requires both. You got to get people to exercise. I mean, we teach them some stuff about exercise as well, but we're not saying, we're going to teach people how to sort of get off the couch because they're not going to. The stuff we teach that you're about to play is 95% knowing what to do and only 5% having to do it. That's the way you get behavior change. You make it easy. So Marty's examples, he talked about the nutrition labels and the overused procedures. And we call out the shopping, we change the shopping behavior by calling out products by name because people don't shop for concepts like avoid less sugar or avoid more sugar and that kind of thing. They shop for products. So get your hands on the buzzers because we're going to play some trivia. So the first question, and I'm just looking at, I think we got a couple of user questions coming in. The first question is, how many teaspoons of added sugar are in this 8-pack of 4-ounce juice boxes? And while you're answering that question, Mark, I think we've had
there is a question here about the Cologuard. Is it equal to a colonoscopy, and does it have false positives?
There are false positives, and I believe it's 13% now. And for those 13%, you do need to get a follow-up colonoscopy. But when you say is it equal, it is actually, even including the false positives, it is a more cost-effective and a more effective way of avoiding significant colon cancer to get a Cologuard every 3 years than it is to get a screen every 10 years. Do we have an answer? Do we have a?
Yeah, about half answered 0, 10, and 20%, and about half answered 30.
Okay, well, the half who answered 30 are correct. It says no added sugar. Okay, that's your first hint that there is added sugar. Okay. If you look at the nutrition label, these tiny boxes have 60 calories. You'll note that most of the calories come from sugar, but they say 0 added sugar. Well, here is the ingredients label. All of these fruit juice concentrates are classified by the FDA as added sugars. There is a loophole. If you add these sugars to a juice, to water, to create a juice product, they are not considered added sugars. If you were added to anything else, they would be considered added sugars. No other vendor helps your employees stop poisoning their kids. All right, next question. I hope we have. I think we have some stuff coming in from the audience here. So,
Yeah.
it's a- which of these is a healthy choice or none of the above? The Harvest Snaps, the Green Machine Juice, the Smart Start, or the Craisins? And Mark, I think you were about to say a question was coming in.
Yeah. What are the best intervals for screening or checkups? For
All
screening?
right, that's a very good question. The one that Harvard has put their seal on for us is, and it's going to vary by individual. One size does not emphatically not fit all when it comes to checkups and screenings. They say for checkups, two in your 20s, three in your 30s, four in your 50s, four in your 40s, five in your 50s, and annually after that, as a rule of thumb. The Quizify answer that we try to get people to do is when you go for a checkup, ask the doctor when you should come back for the next checkup, unless there is a change in your health status. And as a HR benefits person, if you get a note that says they can come back in 3 years, you need to give them credit for the intervening 2 years. You should not get over checked up any more than you get over wellness or over anything else. So what do we have for an answer here?
Well, the overwhelming number of people said none of the above, around
Okay.
70%.
Okay.
And
All right. Well,
only around 10% has got the right answer.
all right. So the right answer is, in fact, the Harvest Snaps. Um, I love these things. You can look on the ingredients label. In fact, actually, I had an empty container and I was going to show you, except that it was empty and my wife thought it was garbage. She threw it out, which is the natural thing to do, right? But they're high in protein, high in fiber, high in vitamins. Essentially, I don't think they have any sugar in them, and just a little bit of salt. So not everything is bad for you. The Green Machine juice is just like the juice boxes, just says no added sugar, full of sugar. The only growing segment of the packaged cereal industry is the healthy cereal, which is to say, full of sugar. It's got some fiber and vitamins, but it's sugar is what's going to get you. And craisins, freeze dry or dried cranberries are literally the worst fruit you can buy. If you look at the label, you'll see that the only way you can make these things taste good is by sweetening them totally. So 75% of calories are from added sugar there. So don't say you didn't learn anything just now, because most of you did. But we're only halfway through. Now we're going to go to Marty's other thing, which is that the overdiagnosis, the overtreatment, the overdosing, Quizify changing behavior by teaching that just because it's healthcare doesn't mean it's good for you. How does the radiation in a CAT scan compare to the radiation in an X-ray? While you're answering that, Mark, we have anything else coming in?
Yeah. What do you think about sponsored exercise like gym memberships or steps challenges?
They are great for kind of motivating employees who are already healthy. They will like them, they'll get some value out of them, but you won't be reaching the ones who would actually benefit from them. In the immortal words of the great philosopher Yogi Berra, if people don't want to go to the ballpark, you can't stop them. So what do we have for this
Well,
one?
there is another question from the
Well,
audience.
actually, but let's I think
Okay.
we could, yeah.
All right. Well, I'd say about half of this group knows what's going on here. They selected the correct answer and half did not.
Okay, well, because I got news for you. I've seen the attendee list, and half of this group has been on our webinars before, and half hasn't. So that's why the answer is, in fact, that CAT scans are full of radiation, and that nobody is disclosing it. And this is not to say you shouldn't get them. You just shouldn't demand inappropriate ones. Oftentimes, it's easier for the doctor just to give it to you. Same with the antibiotics, than to tell you why you don't need it. The United States leads the world in CAT scans by far, and the Journal of the American Medical Association says we have an addiction to unnecessary scans, which in fact, the data would say that we do. So next question is, and I see you had more questions coming in from the audience. What is the number one indication for a spinal fusion for adults? The first fusion didn't work, scoliosis, degenerative disc disease, or herniated disc. And what was the other question that just came in?
What about the vegetable oil in harvest snaps? Is that a concern?
It's perfectly fine. There's not much. Vegetable oil is not going to get you. Oils and fats in general, with the except, well, trans fats are out of the diet. There are some saturated fats that you really should be avoiding, but table oils, vegetable oils, they're fine. They're perfectly fine. Good question. And not that the other ones weren't. So what do we have here?
Okay, we have about a third got the answer correct, and then it's kind of split up between the wrong answers.
Okay, yes, the answer is the first fusion didn't work. This is one of the ways we try to walk employees back from the cliff of serious back surgeries. These fusions are actually increasing in number for the very simple reason that they're now done outpatient about half the time. And so the doctors say, oh, yeah, we'll have you in and out. You'll be back on your feet in a week or two. You will be back on your feet in a week or two most of the time. And you'll feel great for weeks, months, even years. But 10 years later, more than half of them have failed. And that's why first fusion didn't work is the correct answer. There are people who will tell you the whole back pain industry is a hoax, and we come back to our little mantra down below about the back pain and the people being convinced otherwise. In general, one of the things we try to teach people to come up with this on their own is that far more people are harmed by too much medical care than too little, which is why we teach that just because it's healthcare doesn't mean it's good for you. And we have a bunch of general questions as well. I mean, I wish we could spend the whole day asking these questions because this is how you learn. So we mentioned dementia earlier. What is the most easily addressable and clearest cause of memory loss and dementia for some people? Is it inadvertent microplastic consumption, lack of exercise, hearing loss, or added sugar? And Mark, what do we have there?
So how did you convince both Harvard Medical School and Dr. Marty Makary to support Quizify?
Well,
Does he know each other?
So here's the scoop. My ego is decently sized, but nowhere near big enough to pick up the phone and call either one of them, right? Especially Harvard Medical School. They contacted us in 2016 because they liked what we were doing and they heard about it, I think, through mutual contact. As for Marty Makary, he saw us present these questions, not these particular ones, but other questions, and was completely captivated. And we've been in close touch ever since. And we're in his book, and they both love us. I mean, you're not going to find Harvard Medical School and the Trump administration agreeing on too many things because there's one. Okay, so what do we get here?
Okay, the number one choice was lack of exercise, but it's pretty evenly split between lack of exercise, hearing loss, and added sugar.
Okay, well, lack of exercise is usually the answer to our questions, but in this case, it's very specifically hearing loss. Even mild hearing loss increases your risk of dementia. Think of it as, because your brain is having to work a little extra hard to hear, you don't even notice it. Think of it as your tach. Let's say you didn't have a tach in your car. Your engine's supposed to be running about 800 cycles per minute at idling. If it's running at 11 or 1200, you wouldn't even notice, except that your engine's going to wear out earlier. And that's exactly what mild hearing loss. You might think it's just an inconvenience. No, you must address it. And even some of the earbuds now will help you, can function as a hearing aid. So that's basically, okay. I know everybody learned something because a lot of people got the answers wrong. Let's segue into how you actually do this stuff economically. And Peter, I'll send it over to you.
Okay, thanks, Al. Yeah, so another way we're not the same as traditional wellness is through our pricing. So we still offer the conventional pricing because some prefer the sort of budget certainty of having a fixed price. But we were pretty much pushing everybody towards our engagement pricing, or as we also call it, if they don't play, you don't pay. So it's $6 per quiz completed. In case you're wondering how these two stack up, if your employee engagement rate with us is roughly 25%, then they're about equal on average. It also depends how intense that engagement is. But we also cap the engagement pricing. So at most, it would be 25% higher than whatever your conventional pricing would have been. And of course, we have some volume discounts and other goodies that if you'd like to talk, we can go over with you.
An engaged employee learns more about health and healthcare in one quiz, just like you did just now, than most people learn about health in a year from a wellness program for less than the price of one biometric screen, which might be $40 or more, $6 or less. Relevance is what drives engagement in Quizify, not incentives. We are very engaging. We're the only vendor that doesn't have to pay to present at conferences. We get paid. We swap for a booth. That's a unique attribute. One of the things we're going to show you right now that you've never seen before from any vendor is the actual difference between participation and engagement. It is a bright line distinction, and most people use them as synonyms. So this is the Vermont state, the schools in the state of Vermont. In this box is what is incentivized, which is registering, playing every month, playing occasionally, and completing the quizzes. Now, we don't know whether people who are doing this are doing it for whatever incentive. I don't even know what incentive they offer. We just know that they offer one. But we do know that they're playing the quizzes. That's participation, not engagement. Engagement is the rest of this. These are things that do not count toward any incentive in any organization. One is the power user rate. These are folks who either said, that was a good quiz, I didn't get as much out of it as I wanted to get out of it, so I'm going to repeat it. Or, this is an interesting question, I'm going to click through and learn more about it. These are just done because people want to know its relevance. And nobody's forcing you to tell you to learn something. This is the did you learn something new? We're always over 95% on this. And guess what? As Peter was showing a little while, you're not paying. You're not paying for the ones who say they don't learn anything new. And then down below on your screen, you're going to see that there's a number of quiz takers every month. And then there's a number of quizzes taken every month. The difference is largely people playing extra bonus quizzes. We have quizzes that are not relevant to everybody. Remember, we talked about relevance a second ago. Not relevant to everybody, but quite relevant to some people. Example would be men's health, women's health, parenting, aging, pregnancy, aging parents, that kind of thing. You can find those in the bonus category. And guess what? People play them. No incentive. They play them to learn. Well over 1 million quizzes have been completed at this point. So I will turn over to Peter, who will show you how the implementation works, and then we will do our final polling question to see if, in fact, we've convinced you that Quizify is a better choice. Peter?
Oh, okay. Thank you again. So we are, I think, pretty convinced that one of the fears people have is that whatever new vendor they take on, it'll just be yet another implementation headache. And we've heard of, in some cases, clients having over 80 point solution vendors. And so there's, several people have to just sort of manage that full time. So we have tried, I would say, about as hard as is humanly possible to reduce the implementation to just one step, as you'll see. So if we don't have any PHI. If you click, yeah, we don't need any PHI. We don't need any kind of claims data dumps, any kind of analysis. It's very simple. We just need a way to get a link to people. So if you give us a list of emails, we can email it. And if you prefer to send it yourself, you can email it. And that is, believe it or not, our implementation. Now, you have options to do more. If you'd like, you can put it on the intranet, you could put it on posters. But for example, one thing that I think is a meaningful change is that in the past, people would want us to integrate fully into their incentive program. We can still do that. We have reporting that makes that easy. We also have webhooks and automated tools that can make that easy. But it's actually no longer required, and we have made this program work with quite a few clients now. Basically, just sending people a link through emails. We tell them there's a new quiz. Click here, they play, it works fine. If you continue, Al. Okay, back to
Alrighty,
you.
so now it's time for you to speak up. What do you think? And we will, Mark has just been kind of summarizing the answers so far. We will actually post the answers here. Is Quizify a better choice than Wellness? Yes, yes, but we're sticking with Wellness because that's what we've always done. Or no. And while people are answering,
All
do
right.
we have any more
Yeah,
questions?
this is being recorded. If you'd like the recording, email Mark, M-A-R-K, at quizify.com and I'll send it to you. And we've got a question here, Al. What has been the impact on healthcare claims? Does health literacy education drive down healthcare costs?
It does drive down healthcare costs. We make it very easy to measure. We will send you a list of the very specific codes, the very specific ICD-9 and mostly procedure codes that will decline as a result of Quizify. So, for instance, to use the example I gave with the cavities and the filling, that's a D1354. You will actually see a significant increase in D1354s because those are the cavities that are treated with silver diamine fluoride by just brushing it on instead of filling them. Each time you see a D1354, you can apply, assuming you're self-insured for dental, you can apply a savings of about $120 to it. We have the codes for scans, for stents, for essentially everything that we cover that fusions that we're saying is going to go down will go down. And everything we say is going to go up, which is to say the silver diamond fluoride will go up. And then you just take your average cost of whatever that is, multiply that by the number of codes that decline, and you have your savings. It's very simple. There's no regression to the mean. There's no participation bias. There's a reason we got the highest level of validation from the Validation Institute. I can't lie about this stuff. I wrote the book on how to measure things validly. So we can't turn around and measure invalidly. All righty. The final answer is Kerching. Okay, very good. Excellent, folks. That was a little bit risky on our part, but I would be very interested in the nose, but of course it's an
I
anonymous.
didn't see it, Al. What was the answer?
Oh, you can't see it?
Okay, you want me to read the
Yeah,
procedure?
I'm not.
Oh, yeah.
I think that's internal. I don't think everybody sees the result, Al. I think it's just up to
Oh,
you.
okay. Yeah, it's 83% yes, 11% yes, but we're still going to do wellness, and 6% no. So we got an overwhelming answer there.
Now
So
we do
why
have
gets sorry?
some more questions, Al, when you're
Oh,
ready.
well, let me see. Let's look at the time. We'll do one more question now, and then we'll close with why get started now.
All right. Is there a particular way/method that you've seen most successful in terms of introducing this program to the employees?
Essentially, if they know about it, they will come. They will come. So we've tried multiple ways at multiple places. We will tell you what does not work, which is burying this as a tile in your 80 point solutions that are accessible through the main wellness app. In fact, you should do exactly the opposite and use the Quizify questions as a way to customize or a way to teach people about the other things that are in the wellness app. So we should be the way in to this app, not one of the 50 things that you can do once you're in the app. That's the only thing that does not work.
Yeah, and we emphasize the Harvard doctor reviews. Make sure people know that. Make sure that people understand that it's all about education. That we're not collecting personal health information. That seems to really resonate with some employees as well.
Okay, Peter, you want to just wrap up?
Sure. Yeah. So again, as was our kind of five differences from wellness, I mean, it is just very vital to educate employees. The faster we're in a very low level of baseline education on this topic. Even we, and especially Al, because he's like the brains of a lot of the research, but all of us are shocked by, after doing this for 10 years, how much we're still learning and how many things are still surprising about this topic.
This is why I started. This is why I started Quizify. Is that I myself would have considered myself to be health literate, And yet I was deluged with overdiagnosis ideas and overtreatment ideas. I'm thinking,
Yeah.
if this is happening to me, this is happening to anybody. And that's how the company got started.
I'll give you just a really. I know we're over time. If people need to drop, that's fine. A great Quizify example I personally had was I was giving my little kids Honest Juices. It's a brand. And again, like many of our examples cover this, I thought these were healthy. They were very much marketed as sort of like the more healthy, Whole Foodsy type of things. Al informed me and actually had content on that. That specifically, that's one of the tricky ones. That's one of the ones you don't want. There are better alternatives, and this happens all the time. Anyway, so we need this education. All of us need it. It changes behavior. Like convincing someone that it's easy and for their own benefit to change their behavior is much easier than building up their willpower, cajoling them, bribing them, manipulating them, etc. It's just much easier to be aligned. You're only paying. There's really kind of no risk here on any dimension because you're only paying for actual progress. If they don't play, you don't pay. And also, if they don't learn, you don't earn. And we survey people, did they learn? And if they say no, we don't charge you for that. So it's really only for progress towards this learning. Yeah, the next box. Yep, there you go. Our engagement is very high, and we probably spend less effort than other programs. We just send usually a couple emails a month at most to people because people actually care about these topics. They're actually relevant to them. So we guarantee that this will be the most engaging program you have per dollar. And we can even increase engagement on other stuff like your other benefits by sort of putting it in, weaving it into the curriculum. And then finally, like there's no human way this implementation should be anything except the easiest one you've ever seen. Like, you shouldn't even break a sweat because we have removed every step except just one, which is we just need to communicate. There just needs to be a way to communicate it out to people. That's it. That's all you need. And, like we talked about before, we have the Validation Institute, validating us. We work with, I think uniquely work with Harvard Health Publications. And, the FDA Commissioner's book is one of several books that actually praises us for our approach.
Now, we did have a question here about the
Yes.
frequency and length of the lessons of the quizzes. What seems to work best for most of our clients is once a month. It takes about 10 minutes to do. It's 10, questions in all sorts of formats on different types of lessons. We've got all sorts of lessons to choose from. That said, we have tremendous flexibility on the periodicity and the length of the quizzes, but that seems to be what works best.
It's all up to you. It's all up to you. But here's the funny thing: as quick as the 10 questions a month is, that's more actual real learning than most people will ever do on this topic in their life if they do that for a year.
And don't forget, we've got all these bonus quizzes as well. So if people really want to get into it, they can. And also we have a special way of taking this information into the doctor's office that we didn't have time to cover today. So you've just seen basically I just sound like a cliche, but it was a tip of the iceberg.
Mm-hmm.
And I do believe this once again, as we always do, and right on time. So unless there's anything else, I think we will sign off. All right. Hey, thanks for joining, everybody.
Thank you. If we didn't answer your question, you're going to get an email with the answer. Thank you.